Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences and knowledge from the successful medical practitioners. And today we have Dr. Prem with us. He is a practicing geriatrician in Jaslok Hospital, Mumbai, and has been educating old age people throughout internet since a long, especially in this COVID times. So let's welcome him online and ask him what all he has been doing. Why did he pick up geriatrician as a branch, and what is it interesting that he finds in the space? Welcome, Dr. Prem, to the platform. It's really nice to have you here.
Good morning. Thanks a lot. Yeah.
So he is going to tell us about the scope and opportunities of the field of geriatrics. So let's start with a brief of your journey, doctor. How did you, what all did you do? How did you pick up this branch? How did it go?
So basically, I would say that geriatrics per se, I mean, when I was in MBBS, I myself did not know much about it. And as we went ahead, we obviously realized that there was not much talk, even in MBBS, about what you should do for old people. It was always maybe a few chapters, maybe one lecture.
Yes.
It has increased now. So then what happened is sometimes they say that you get a calling. So I was actually preparing for my entrance exams, and it was the first year I had given, and I was ready for the second year. So then I just sort of gave. There is a college known as Amrita Institute of Medical Sciences in Kochi. Amrita Vishwavidyapeetham is actually a very famous university, which I got to know. You see, you discover gems when you get into them. You don't know about them before. So very well run. So I got this opportunity saying that there is something known as MD Geriatrics. So through counseling, you can get through that. I was like, to be very frank, I didn't have any idea. So there are people in India who have been pushing geriatrics for a while. So I contacted one of the team members of that in Chennai. So Chennai can be called as the haven of geriatrics because in 1996, Madras Medical College, they actually sort of started it. And so it's not very young in India, but it's quite young as compared to abroad. So then I asked, and they were like, no, it's like medicine, but you need to know a lot about older people. So I was like, okay, let's take it a shot. So even in my first day, I knew a bit only. It was all medicine. But then when I was actually lucky to be trained by people from who were trained in the UK specifically for geriatrics. So my head there was Dr. Josh Paul and Dr. Priya. So they actually guided me really well. And then by final year, I had complete clue that geriatrics is actually something which should be there like pediatrics. So but like pediatrics is for kids, there should be geriatrics, which should be for more than 60 years of age. And it actually focuses on holistic sort of approach. Then I was always close to my grandparents. So maybe in that way, it was maybe sort of easier. But then to be very frank, as I got into it, I understood. And then from there, my journey took me to AIIMS, New Delhi, where Dr. Day, who has actually been the pioneer of geriatrics in India. So working with him sort of really channelized my entire thing. And as AIIMS, you're obviously polished really well there.
Yes.
With research and medicine and patients, everything sort of. So then that holistic sort of thing came into geriatrics with a lot of research adding onto it. And then that's how my journey of geriatrics then ultimately brought me to Bombay. I felt that there is not much happening in elder care in Maharashtra per se. So then I came to Bombay, and then I started the Department of Geriatric Medicine in Jaslok around 2 years back.
Okay.
And then that's how we are going from strength to strength now.
Okay. So that's amazing. That's really nice to know. So you have already mentioned, that you explored your journey into geriatrics, understanding first about the branch and then building your interest into it and then getting into it, right? So what exactly did you like about the branch? Why did it become your calling? What is it that you find which is not there in any other branches?
Yeah. So I would say, I mean, as far as I'm concerned, I think I chose geriatrics and geriatrics chose me. So maybe that is the way I look at it, because when I was doing my MBBS, I never, to be very frank, thought that I would get an opportunity to get into AIIMS and work there. But then geriatrics sort of got me to do that. And now, of course, starting a department itself is sort of such an honor. So the thing with geriatrics was you have to understand old people. So old people are quite complex in the way that you cannot treat them like kids at the same, because you have to respect them. At the same time, you have to have that empathy. You have to have that humane approach, and then you have to be able to understand them. It might not happen in your first meeting because they have to obviously get your trust. So that happens a lot. So maybe the fact that I was always a bit soft spoken and was able to sort of connect, maybe we learn our way through it, and that's how sort of it came. So how is it different? I would say time. You need to give the older people a lot of time. So I give a lot of time to my older people, and what I do is known as a comprehensive geriatric assessment, which is which is a series of scales where you actually look at the memory, you look at the depression, you look at the physical status, of course, you look at how active they are, independence, activities of daily living, whether they are able to do, how dependent they are, their social paradigm, where they live, whether there's a history of falls, whether there's a history of urinary incontinence, whether there is a history of admissions. So all medicines, I think medications are sort of so important. So when you give time to them, they open up, and then ultimately you're able to get the entire history. So that's how geriatrics is. So you get a comprehensive, holistic approach to that older adult.
Yes.
And you also need to know who is the caregiver and things like that, because you can only give sort of. So it's basically a multidisciplinary and interdisciplinary teamwork. So for example, I will be there with a physiotherapist, with a dietitian, with a social worker, and plus minus whoever specialty is needed. Three things matter a lot: vision, hearing, dentation. I mean, you as a dentist, you must be obviously knowing that, because it's so important. Because during this time also, what happened initially, dentation could not be addressed because of the pandemic. So a lot of older people suffer. Because they just couldn't eat. But now, of course, slowly as we are improving, so these things, so that's why the finer things are very important. So that's what sort of, you can say, attracted me. And it's like you have to get a whole knowledge of that older patient, because after you, maybe they don't have anywhere else to go. So it is, as health is defined as a medical, physical, medical, and social well-being. So that's what you're targeting. You're targeting into give him that care not only in the hospital, care maybe to the home, and ultimately trying to get them in the community. So that is known as a continuum of care. So geriatrics is a continuum of care.
Okay, that's a lot of thing, and definitely very interesting in comparison to any other branch, to completely deal with the patient so holistically. So now when somebody plans to get into geriatrics, are there all the colleges providing masters in the same? For you have done from AIIMS. What I know, maximum of, there are very less colleges who do that. Which one are those, and how to go through that?
Yeah, so basically, as of now, as you know, there is a NEET, and there is also the specific examinations. A lot of them have been sandwiched anyways. So I actually finished it from AIIMS Kochi. So I was the first batch of that. And then I did my senior residency in AIIMS New Delhi. So yeah, of course, if you see, the good part about geriatrics in India is it's there in the premier colleges in India. So it's there actually in Amrita Institute of Medical Sciences, where I did, AIIMS New Delhi. Then it's there in Madras Medical College in Chennai, which started it. It's there in CMC Vellore, which is another legendary CMC Vellore, which is another legendary college. Then it is also started recently in BHU, Banaras Hindu University, Varanasi, which is again one of the, if you say, one of the premier. Then it is also there in Maharashtra. It's there in Government Medical College, Aurangabad. And in Bombay, it's there in Mahatma Gandhi Missions Medical College in Navi Mumbai. So that is, of course, so these are all the colleges in India, and obviously everything is through entrance. And more colleges are there. So there are something known as regional geriatric centers.
Okay.
So there are main centers, and then there are regional geriatric centers. So all I entered was main centers. Like for example, JJ in Bombay also might develop. There are a lot of departments which are getting developed throughout, because that's a need of the hour. We have older people
getting developed.
More and more older people. So we need more and more people trained in geriatrics to actually sort of do it. Then, so that's how, and these are the MD sort of things. And of course, you have to get into it through, of course, the
examinations. Yes.
Yeah. Then apart from that, of course, there is something known as Public Health Foundation of India, which is a course which I'm a part of. So we are trying to train general practitioners into sort of knowing about geriatrics and trying to give them the nuances through workshops. So that is one case. Then there is also something known as IGNU earlier had a PG diploma.
Okay. Okay.
So a lot of people actually did that PG diploma in geriatrics as well. It was of Indira Gandhi Open National University. So now I think they are going to come back with another one. Then there have been efforts in trying to train MBBS students, because we feel as we go, we have to go more basic. So when we train them, at least by the time they have idea of getting PG, they already know that what they can expect in geriatrics. Because what happened during our time is that we didn't have that much clue that geriatrics, how to separate. But now we are trying to inculcate in the MBBS students that they should at least know what they can take up.
Yes.
Because not having an idea, and as you know, I mean, we have all undergone we go into counseling and we are like, okay, you get MD, you're getting MD geriatrics, and you have that split second or some minutes to decide. So if you don't have a knowledge from before, it becomes very difficult.
That's true. That's true. And that's very nice to know that, the Public Health Foundation of India, IGNU, all of them are doing, small courses to help MBBS people guide in the right direction to understand what geriatrics exactly is. And I completely agree from the doctors and also, and from the patients and also, and it is a very specialist branch for, and a much needed now. So now if somebody, definitely now, if somebody reaches to your level, who has already done their MD, are doing really well, and picks something where it gets interested in some branch in geriatrics, because geriatrics also has multiple branches that you just mentioned. Are there any further courses and fellowships for people who want to opt for that?
Yeah, so of course, fellowships, I would say there are two types. One is, of course, if you actually have to sort of do something and try to work abroad, then you might actually have to get into their system, which everybody knows. For example, if you have to go to the UK, you will have to clear the MRCP medicine, then you will clear the MRCP geriatrics, and then you will have to follow their ST1, ST2, and you will have to get into the registrar post and then work. But you'll be working as geriatricians, because I know people from AIIMS who are doing that.
Okay.
So that is one way. Then of course, US will be the same, wherein there are a lot of universities, whether it's John Hopkins, who are actually providing you with that. So they will obviously see your CV, you'll have to give interviews, you'll have to have the score, and then they'll sort of get you in. Australia, again, of course, again, you have to undergo the same thing. You have to get their entrance, then you get into there. There are observerships, of course. Observerships will not be degrees. Observerships wherein you can go to university, spend 1 month, and then obviously try to learn the nuances of what's actually happening abroad, and then try to inculcate it in your own practice. This is pure geriatrics. Now, if you want to specialize, now as far as specialty courses are concerned, it can be like any other. For example, you can have fellowships. There is a lot of interest which has been developed in geriatric oncology of late.
Okay.
So there are fellowships in geriatric oncology. Then there is fellowships in cardiology as well. So with your geriatric background, you can obviously learn the cardiology part. So cardiology rehabilitation. One of my batchmates from AIIMS actually recently did it also. So as they say, of course, this pandemic has helped in that as well, where you can actually sort of explore that. Then a lot of pain and palliative care is also undergone by geriatricians. So you can actually add on. Like there is an Indian Academy of Palliative Care, which is in Trivandrum. So they are having courses. So you can add on as a geriatrician, you can actually do that and also be a pain and palliative fellow. So those things also sort of help. Okay. Now, unfortunately, there are certain courses in India, especially DM overall, still MC, of course, is dissolved as of now. So the NMC will decide whether MD geriatrics people are allowed to do DM. As of now, no, because in most things it is written MD medicine and the allied. So MD geriatrics per se has not been yet included. It's in process. Hopefully it will be included, and then maybe people can sort of do DM as well. But most people opt for fellowships, because if they have a specific calling, like they want to do geriatric nephrology, they want to do other things, and then they sort of do it. But you have to be country specific, and you have to see which country, if you want to go abroad, try to get details of that particular country, and then try to get into their system. And of course, or you can purely do MRCP, which can just be adding on. It's not necessary. If you're not going to go there, then it will be only a degree which will be adding on to your sort of repertoire.
Yes. True. So now you mentioned that, if you're going anywhere, you can plan accordingly to do the specialization according to the place you're moving into. But there must be a lot of opportunities for a geriatrician abroad, isn't it? Because comparatively, the system has already been set outside India for the care of the old age people, which is still going on in India. India as a country is still developing with that segment, what I feel so, compared to any developed countries like US, UK. They have a system set. So how are the things differently there when it comes to working as a geriatrician in other countries and in India? How is it different? Is it, how do you feel as a geriatrician, how different it is?
Yeah, I would say, the demand is actually quite high in India as well. It's basically education of the people. So I, as a geriatrician, have to educate people like what geriatrics is and how different it is. So for example, because in 1996, it started in Madras Medical College. So the South, Bangalore, all these people, all these areas, they are more educated in geriatrics. So they know what is a geriatrician. So they have a lot of clubs. They have a lot of older people being taken care of health. Then in small places like even Coimbatore, people have geriatric healthcare sort of assistive services, assistive living, doctors who are taking care at home. So a lot of things are actually happening in India. So opportunities wise, actually more and more people, startups are actually including. I mean, this time has really worked well in the pandemic, where more and more startups have thought how to sort of connect with older people.
Older people, yes.
So that is also that. So opportunities for doctors will be there in that way also. Now, as far as abroad is concerned, I mean, some few months ago, last year, I think it came in Medscape only, that the demand for geriatrics in abroad is almost 400%. That much shortage.
Okay.
So that's how it works. So the demand abroad is really there. So if people are actually wanting to ultimately, I mean, educate here and then go there will be opportunity. Of course, you have to sort of take the exam and then try to plan out. But then there is definitely, because there are a lot of, you can say they are more geriatric friendly purely because in 1909, English Neo Nasher coined the term geriatrics. In the 1990s, when we started the first geriatric center in India in MMC, they were talking about, there is lack of geriatricians. So we are at least 20 years behind, you can say.
Yes.
So that time will come for us as well. So it is responsibility of the current geriatricians, that me and of course future students who take up and build more and more capacity in India. And then of course it's an option. Then you can also think of, for example, going into research roles.
Okay.
Like if you want to do a PhD, because MD PhD is very common abroad. So if you want to go, if you can do a PhD in geriatrics, whether you want to go in molecular level, whether you want to go in cancer care, whether you want to go in dementia, because there are a lot of ways you can actually sort of branch out. So there are opportunities abroad, no doubt. So you have to sort of just see what part of geriatrics is your calling, or if you want to do as a geriatrician, then of course there are a lot of house posts.
That's a very encouraging thing to know, because at the end you want to land up into a good place and a good position. So now when it comes to being a geriatrician, how is it different in India? How is it different in working in a metro and a tier 2 or tier 3 town? Is it that there is need also in the tier 2 and tier 3 towns, or it is just the metros, the good hospitals who are serving?
No, I would say the need is throughout. Purely because if you still talk about India, the maximum amount of people are in rural areas. The maximum amount of older people are in rural areas. Yes. The total population, if you see, the divide is urban, rural areas is much, much more. So what I would want to say is ultimately you have to have geriatrician training at centers. It has to happen at primary health center. It has to happen at secondary, tertiary, then as you go. So that's what the national policy of healthcare in the elderly wants the regional geriatric centers to do. They want to make sure that they build the center and they also educate the smaller areas in that particular area, so that you know when to escalate a case. Because ultimately the thing is, not every center can become a proper geriatric friendly center, because ultimately everything has its limitations. Yes. For example, in tier 2 and tier 3 towns, there might be general practitioners, there might be MD physicians who are actually managing the older people. Yes. So the only way to sort of reach out to them would be to actually train them. So I think training is very important through various courses. So they get trained, they handle better, and then they know when to sort of give it to sort of towns. Now, it's very different when you go to proper cities like metros, Bombay and Delhi, even Bangalore, even Chennai, because then you have to have this comprehensive model, wherein you will have the hospital model in which you will obviously admit patients, see OPD. Then you have the only house model wherein the doctor will go, then companionship, because intellectual companionship, which we actually provide through Graceful Living, which is one of our sort of organizations, wherein you just spend time with the older person.
Yes.
Because that is important. There are a lot of alone living people who actually think they're isolated. So the mental sort of thing has to be taken care of.
Yes.
Then there is, of course, the assisted living. And then there is old care homes. For example, there are specific homes for dementia.
Okay.
Then there are also elder care communities. So elder care communities, especially in Pune, we have this elder care community, which is a huge number. So ultimately, you need doctors to take care of them also. So there will be demand. Then health checkups, older people have. So, but it varies. As you go into the cities, this is how it will work. But as you go into tier 2, tier 3, you might actually have to focus on training people who are already there. And of course, if somebody represents, for example, it just takes one sort of drop, one person who actually gets an MD, and then that particular person can change the paradigm completely.
Yes.
But till then, I think training matters a lot. The more you train people, the more they will be able to tackle. They need to know what is different, the nuances, so that they can treat them well.
But this is an incredible thing for MBBS people also who are planning to settle down in tier 2, tier 3 town, to get trained in the geriatrics branch and work as a specialist there, because this is something which can help them to create their own space in their area. So this is something that I believe everybody, MBBS people should explore. And if they, as you mentioned, if they understand the field better and want to go deep into it, can definitely go for their masters and do an expert job as well. So, yes. So this is really nice to know about the branch. So now when, there are so many students listening to you, so what are your motivational words for these students to pick up this branch, or anything in general that has made you be a wonderful, doctor and a human being? Any motivational words for these students?
Yeah, so I would, you need to obviously, as a student, we always get into certain times where we are unsure that whether you want to pick a branch, whether you don't want to pick a branch. See, there are, I think, 2 or 3 types of students. One is that you surely know, like, no, you want to be a surgeon, so you just want to do it. So when you don't get it, you don't want anything else.
Yes.
Then there are people who get the rank and they are like, whatever we get it, we will see. If we get radio and I deserve it on the rank, I will take it. Then there are people who unfortunately come in between rank and they sort of get certain branches which they are unsure of. So I would say, as a student, one is that you need to know about your branches from beforehand. And as far as geriatrics is concerned, I would say it's all about education. It will require patience. So don't think that because you are an impatient person, you cannot take it. No, skills are obviously developed. When you before entered into MBBS, you obviously didn't know anatomy. You didn't know physiology. So you didn't know how to cut a body. I mean, for dissection. So you learn through it. So skills you develop, ultimately communication. So I think communication is very important as far as geriatrics is concerned. Communicating with an older person wherein you don't offend them. So even if you don't have, you can obviously work on that. Then if you really feel, I wouldn't say that you should always just because you're close to older people, that's why you would want to take it. There is a challenge. They are heterogeneous group of population. I mean, there is so much to do. Most trials earlier were actually getting them out, but now more and more older people are getting involved in trials and research. So there is so much to discover. And with a lot of anti-aging and trying to sort of get people better. See, prevention is better than cure is always in medicine. So even in older, we want to make sure that they live gracefully, because death is a truth. So ultimately, we need to motivate ourselves into sort of believing in that. And see, it's about time. You give time to them and they will sort of open up, and ultimately you will be able to sort of have that joy also. Only one thing, which is, I won't say it's a flip side, you should always see, and it happens with every medicine person, is that you will lose them, because death is going to be a part of it. But that I think is more with people who are dealing with, even for example, oncology. To be very frank, oncology people have to develop that. So I would say you might have to develop that thick skin as you go along,
Yes.
that you have helped them in that journey. But that journey is going to come to an end, because ultimately it's going to, their life is going to end. But it's such a joy. They have so much experience. You the respect that they sort of, the wishes that you get, the goodwill that you get from treating them, and the way, we are like their children, and they give you best wishes always. So getting all that into, you say no, you collect all the goodwill into the piggy bank, and it sort of adds up. So all those things really sort of give you that, at the end of the day, it gives you that happiness. But at the same time, there might be limitations. So you need to know when not to treat things in older people, when to be aggressive, when to take a step back, because ultimately the body is not young. So you are dealing with three things here. You are dealing with an aging body, you're dealing with an aging body with disease, and you're also dealing with an aging body, disease, and their interaction with medications you're giving. So then it's sort of multiple levels. So I would say in older people, you have to keep it simple. The more simple you try to keep, break down their problems, and then you are able to sort of treat them. And I think you just need to respect them, and you get that respect back, and ultimately you will be able to do a sort of a good job. But it's a need of the hour, and more older people. People are just getting older. There is young, old, middle, old. So it's like 60 to 69, 70 to 79, and more than 80 years. So, and we are pushing the envelope. More and more people are living over 100. More and more people, especially in this time. And the COVID time also, a lot of old people are surviving. So it's not that they're not surviving. So they have done something right. So that's why they are. So longevity is there. That's why the demand for geriatricians will be even more, because it is known as a silver tsunami. Suddenly it just sort of will come, and we will not have doctors specific with that training to actually sort of take care. So that's why I think more and more people should take it up. Then you see whether you want to branch out, you don't want to branch out. That is, of course, an individual choice. But try to have that base, because ultimately when you're a geriatrician, you understand that you are able to look at that older person as a whole and not miss anything. So that sort of approach helps.
That's true. One more thing, last thing I wanted to ask, you just mentioned that there are multiple research going on. So are there research posts also there in India also for geriatricians? Are that much of research going on? What kind of job opportunities? I've just missed this. What kind of job opportunities?
So for example, in research in multiple places there is. For example, even doctors obviously can. In AIIMS, we have a PhD. Then in multiple other places also, there is a PhD which you can actually do. Then the good part is you have multiple projects which happen in research institutes like AIIMS, like JIPMER, like even PGI, wherein you are able to be an SRF. There is a fellow or a research officer, wherein you are obviously will be the one who will be doing the research, and then obviously that can escalate into a full-time research job. So PhD is very much there, and I know a lot of people from AIIMS who are actually sort of done that PhD. So one of them is obviously more of a geriatric oncologist. One of them is got into, there is a longitudinal aging study of India, so dementia care. So there is a lot of sort of things which are happening, and ultimately because it's multidisciplinary, so research helps. So for example, if you're a psychologist also, you do the research and you're trained, and then ultimately you can work in dementia care. So it's not only limited to sort of only doctors. It can be sort of doctorates can be done, and ultimately you can sort of have that opportunity. So you can go into research also, or you can be a clinical doctor, or you can be both. In AIIMS, usually it's a combination.
Okay. That's so interesting to know, doctor, about so much about the geriatric branch, how interesting it is. And I'm sure your life on an everyday basis must be very exciting, meeting different kind of people, learning about their experiences, and getting a lot of goodwills in your piggy bank. Definitely, it must be, really very interesting. All of you students who are listening, I'm sure this discussion must have helped you to understand the branch geriatrics and understand how interesting it is to also to understand if you have a feeling and feel for taking care of the old age people. or you want to explore it, there are multiple options to explore, as the doctor just mentioned. Explore the branch, and then you will understand that you want to explore it or not, especially now when this is an upcoming branch in the country and there is a lot of need everywhere in India as well as abroad. I believe this is one of the best branches currently to pursue and to get into, so that you can make your feet into the space before it gets established in the country, and have a running practice already before there is any other geriatrician in your city. So do explore this branch. Do look forward to knowing about it before you select any of your branch for your masters, because I am sure once you start exploring it, I am so, impressed by this branch that I believe that you will think about it once. Do share this interview with your friends and colleagues who are planning to do their masters, or are confused and are looking for some kind of guidance. I'm sure this will help them to explore a new branch, to understand something new, and to know that there is a different way also to establish themselves. Thank you so much, doctor, for this insightful discussion. I'm sure it will help so many people, so many students out there to understand the branch geriatrics and to explore it now, and will add to your bunch of geriatricians in the country. So thank you so much, everyone. Yeah, thank you so much, everyone, to be a part of this discussion, and do join us for our upcoming interviews coming Wednesdays and Sundays. They are going to be another very interesting topics. Do join us live in those as well, and also watch all our previous interviews on our Instagram and our YouTube page. They will give you, they will also help you to understand deep insights about different branches, different subjects, and give you a new perspective in your career in medicine. Thank you so much, doctor. Thank you, everyone, for viewing this. Thank you. Bye-bye. Bye-bye. Thank you.